Hey everyone, if you're watching this video, you might be one of those people who's already tried medication for things like anxiety and depression, and maybe you got off and you don't want to go through that again, or you're afraid of what could happen if you get back on and you end up in a situation like mine, which I understand. I wouldn't want to be in my situation either. Or maybe you haven't even tried medication and you just realize that there are some risks associated and you don't even want to go there. And so a question that I do get a lot from people on YouTube and Facebook is, what do I do? What are my other options besides the medication? And I'm here to tell you that you have some great options available to you that are far more effective than these medications, that can be life-altering if you implement them effectively. So I'm going to share with you what has worked for me and my family that I know works, and I hope that it will help you and your family. The number one thing that I have said before, and I cannot stress enough, is nutrition. Nutrition is key. And there's a lot of information out there about nutrition. I'm going to try and narrow it down for you a bit. Paleo is a big thing right now, and I think that's actually a really great option to consider. There's a book by functional psychiatrist Dr. Kelly Brogan. She's really big on eating paleo from what I've read so far. Haven't finished the book yet, but it's good. She knows what she's talking about, and it's all about reducing inflammation, because inflammation can lead to mental health problems, can lead to other health problems, which then lead to depression and anxiety. So I do recommend A Mind of Your Own. Before I even ended up in this whole benzo mess, I completely revamped my diet. And there were a few books, one of which I don't think is available anymore. The first book I read was called Your Final Acne Solution, or Your Last Acne Solution, by Leo Keeson. It was an ebook, and it was great, and I followed that thing, and it absolutely, I had so many health problems that cleared up, so many chronic issues for myself, my husband, my child. If you can't find that one, there's also another book that I used called The Maker's Diet by Jordan Rubin. That's a fantastic book about how to eat naturally, how people used to eat, how to make those kinds of foods. And then another book by Kat James is called The Truth About Beauty. And that one is about eating so as not to spike your blood sugar, really. I mean, that's her main focus. And I think that is crucial. If you have anxiety on any level, you need to learn how to eat so as to not spike your blood sugar. If you spike insulin, that's going to affect cortisol, which affects adrenaline, which then messes with sleep hormones, and then you don't sleep and it becomes this vicious cycle. Everything gets off. So that's a good one. And finally, there's another book that I read a while back called The Orgasmic Diet, and it's kind of about eating good fats and things, but more importantly, that one helped me understand how to use various supplements in ways to help with occasional bouts of depression and anxiety and things like that. So I think for that reason, if you want to learn a little bit more about supplementation, that's a good way to go. Along those same lines, I think people need to get genetic testing done. I did mine through a company called 23andMe. You do it online. It's pretty simple. You just send them a saliva sample, you send it in. It does cost a bit of money, but I learned that I'm one of those people who should have never taken an antidepressant. That would have been nice to have known before my doctor prescribed it to me, and I swear everybody in these support groups has the MTHFR gene. I think there's a huge correlation between that and having the severe reactions that we have to these medications as opposed to the people who don't. And if you can learn why, avoiding something like folic acid in a vitamin or in packaged foods can help you deal with the physical aspects that are creating anxiety and depression, that can be life-altering. So I really do highly recommend getting testing done, getting together with maybe a functional medicine doctor or a practitioner who does understand genetics and can help you figure out, okay, what do I do now with all this information? And there was something else along those lines, which I will remember later. Okay, so moving on, there is a program that I used when I got off Cymbalta. which I was taking supposedly for fibromyalgia, which now I realize the fibromyalgia was pain because I cold turkeyed Ambien. But anyway, so I got off Cymbalta, and for the first time in my life, I experienced true severe anxiety, panic. I didn't really know what anxiety was before that. I didn't know it could be so physical. I mean, where you're literally shaking. It was awful. And my friend recommended this program called Attacking Anxiety and Depression. She sent me home with part of what she already had, and then I ordered it. I started working on it immediately, and I improved so dramatically. Just from one day to the next, working on this program, I could literally like feel my brain rewiring. It's so worth it, and it's a lot. It's similar, I guess, in ways to working with a therapist and doing cognitive behavioral therapy, but you can do it at your own pace. You can do it from the comfort of your own home, and in the long run, it's actually kind of cheaper to do this, even though the price tag may be a bit of a shock at first. You can get it either through the Midwest Center online. I think you can also order it on Amazon, and that's a really good one to look into. Oh, I know what I was going to say before. So when you're going to see a functional medicine doctor or a more naturopathic practitioner, it's important to get blood work done. Really important to look at thyroid and other things which might be affecting your anxiety and depression. And unfortunately, the tests that regular doctors use, they're just not that accurate. They don't pinpoint things as well. My doctor has helped us so much, not just me, but my own son who's dealing with an autoimmune condition, and his tests helped us work out a plan for my son that was far more effective than the ones that we got from the other specialists that we had seen. So getting the right kind of blood work done is crucial, but any kind of blood work can be helpful, and Kelly Brogan does go over that in her book, so that's another good reason to check hers out. Okay, so moving on from that, besides the cognitive behavioral therapy and the Attacking Anxiety and Depression program, if that doesn't work for you, or it's not effective enough, hasn't been effective enough in the past, although I think maybe if you combine it with nutrition, that could totally change for you, there is the option of hypnotherapy, which is something that we have used for my child. I have a child who has severe anxiety, and that's related to an autoimmune condition and the inability to absorb nutrition. I know it is. But he's got to learn how to deal with it. And so we started taking him to see a hypnotherapist for 6 weeks. That's it. And it was unbelievable how effective that was and how fast things started to work. Again, sticker shock. There it is. It can be pricey. You got to make sure you find a good one. But if you can do it, I really highly recommend hypnotherapy. It's a great option. So those are some things that you can do that almost sound too simple in some ways, but when you try and implement them, I know it can be so hard. Really what we're talking about are lifestyle changes here, but if you want to improve your quality of life over the next 10, 20 years, then that's what you have to do. You have to be willing to make some changes, make some sacrifices. And these are things that work. I know they work. They worked for me before. They worked for me post-benzos. And I know that they can work for you. So I'm going to provide down below some of the resources that I've mentioned, so you can look into those some more and study and think about it and think about what is going to work best for you. And if you have any that have worked that you know work, please share them down below so other people can benefit from your lived experience. And we'll talk to you guys later. Bye.